All right, let's finish up with the muscles of the leg. This may become a little bit easier now that you know the movements, how muscles are named, etc. You've probably looked at several muscles by now. I think the leg is a little easier. But muscles that act on the thigh, which would be this region here, the joint would be the hip. If these muscles act on the thigh, you have the gluteus maximus, which we probably all know where that is, or what the function of that is. And what the gluteus maximus does, it extends the thigh. Now think of like you're taking a step on stepping up on a stair. Anyhow, it extends the thigh. It's an easy movement. The gluteus medius, which is right here, it's often an injection site, that abducts and immediately rotates the thigh. So gluteus medius, gluteus maximus. Then you have the iliacus and the psoas major. For some reason, that's not wanting to focus very well. That's worse. All right, it's better. All right. This right here is the psoas major. If you think of the tenderloins on a deer, that's the psoas major. And the function of the psoas major, it flexes the thigh. That's probably the easiest function, or it flexes the trunk, like when you're doing sit-ups. Sure, your abdominal muscles are used, but also you're going to use your psoas major. Then you have the iliacus. Now this right here is the iliac crest, or the coccyx bone. So there's the iliac crest. Remember the three regions, the ilium, the pubis, and the ischium? Well, this upper region would be the ilium, so this is the iliacus. And what the iliacus does, it helps flex the thigh. Together, those muscles are called the iliopsoas, but typically I'll ask you one or the other, either the psoas major or the iliacus. Now when you look at the quadriceps, if I can get this to focus better, probably not. Let me zoom out a little bit more, maybe that'll help. Well, oops. I guess that's as good as it's going to get, but these are large muscles. Now this is the medial side. This is the lateral side right here. If I was to show you the whole leg, all this would be the medial side. This is the lateral side. So here's the anterior part of the thigh right here. Let me zoom in. So you have your quadriceps. And we call these quad because there's actually 4 muscles, but you really only see 3. You've got the vastus medialis, which is on the medial side. You've got the rectus femoris in the middle. Then you have the vastus lateralis, which is going to be the lateral muscle. So vastus lateralis, rectus femoris, vastus medialis. And basically what all those muscles are going to do, they're going to extend the leg at the knee. Now when I mention, think of leg, it's the lower portion. This is leg. This would be thigh. But the action is going to be accomplished at the knee joint. So if you put extends the knee, extends leg at knee, or extends leg, any of those movements would be fine for either the vastus medialis, rectus femoris, or vastus lateralis. Now the fourth one that you don't see is the vastus intermedius. I will not put it on the exam, but if I was to take some of the muscles off, you would see it underneath. But that's where the term quad comes from. There's actually 4 muscles, but you really only see the 3. Here you have the sartorius. It's quite a long muscle. The sartorius. And what the sartorius does, it flexes and it also abducts and laterally rotates the thigh, the hip. but it flexes, but it also abducts. It abducts. It laterally rotates the thigh. Now, on the lateral side, you have your tensor fasciae latae. And what it does, it helps stabilize the hip and knee joints. It also abducts and internally rotates the thigh. But if you just put stabilizes the hip and knee joint, that would be fine. There's the actual muscle right here, but all this connective tissue, the fascia is associated with it, but there's the muscle. The tensor fasciae latae. You know, if you were to put your hands near your hips and just kind of shift your weight side to side, you'd feel that muscle flex. But tensor fasciae, oh, that's fascia latae. Tensor fasciae latae. There's your sartorius. There's the vastus. Rectus femoris, vastus medialis, vastus lateralis. So if I look on the medial side, I have my adductor longus. Blow this up a little bit more, zoom in. And again, you got to keep, my muscles are layered, and we're only seeing a small portion of this, but here's the medial compartment. There's the adductor longus right here. If I were to move this muscle and this muscle, you'd see that it's much longer, and that's the advantage of visible body. You can actually pull those away and see how long it is. That's the adductor longus. It's between the sartorius and gracilis. So what the adductor longus does, just like the name implies, it's going to abduct the thigh. It also flexes and immediately rotates the thigh, but if you just put adducts the thigh, that's fine. You have the gracilis, which is that long medial muscle right there. It's also going to adduct the thigh. It also flexes and immediately rotates the leg at the knee. But you got to keep in mind, all these muscles on the medial side are going to abduct. They're going to pull your legs inward. Or like squeeze your legs like if you were riding a horse. So that's gracilis, adductor longus, sartorius. This is going to be my adductor magnus. It's a large muscle. Again, if I were to pull some of these muscles away, you'd see how large it actually is. And again, what the adductor magnus does, it's going to adduct the thigh. It also flexes and immediately rotates the thigh, but again, adducting the thigh would suffice. So adductor magnus, gracilis, adductor longus. This is my sartorius right here. Vastus medialis, rectus femoris, vastus lateralis, tensor fasciae latae. And lastly, on the anterior part would be the pectineus. And it's actually a lot larger muscle. Show you that a little bit better. This muscle right here. This muscle right, not this, don't confuse it with the adductor longus. It's right here. And again, it's a lot larger muscle, you just can't see a very large portion of it. It's covered by their muscles. That's pectineus right there. Visible body, you may see it a little bit better. But what it does, it's also used in adducting and flexing and immediately rotating the thigh. Pectineus. Now, if we look at the posterior leg muscles, zoom out a little bit. You've got the hamstrings. What people call the hamstrings. Don't call it that on the test. This muscle that's going to be on the lateral side is the biceps femoris. If I zoom out, here's the posterior view of the leg. So this is going to be the lateral side. You go look at the big toe that's on the medial side. Use that as a reference. But this is the biceps femoris. basically what the biceps femoris does, it's going to flex the leg, or flex the leg at the knee. Now, these two right here, the two semis, you have the semimembranosus and semitendinosus. The two semis. So here's my biceps femoris. See that any better? But look at this tendon right here. See this long tendon right here? That's the semitendinosus. And if I look right here, this muscle right here and over here, that's a little bit more medial. Don't confuse that with this muscle right here, the gracilis. But right underneath the semitendinosus, this muscle, it's right here. Oops. This muscle, this muscle. See if I can move this down a little bit more. Oops. That's part of the semimembranosus there. You can see it right here, going up. And again, use visible body. You can actually pull the semitendinosus away, and you'll see the membranosus. So this is the tendinosus. I always think of the tendon, the long tendon. Semitendinosus. There's the membranosus, which is going to be more medial. Those are the two semis. And again, they're all going to be involved in flexing the leg, or flexing the leg at the knee, or flexing the knee. Now when we look at the lower compartment of the leg, or I'll just say the lower leg, we'll start with the tibialis anterior. That's this muscle right here. Again, there's the big toe. Follow that muscle up right there. That's tibialis anterior. And what it's involved in, it's dorsal flexion. Inverts the foot. But if you think of dorsal flexion, like pointing your toes upward, that's the function of the tibialis anterior. Then you have your extensor digitorum longus. Look at all these tendons right here. Again, we're not looking at the big toe. But digits 2 through 5, got that right. There's 4 of them. There's digit 2, 3, 4, and 5. If you follow all those tendons up, right here, this muscle, right there, that muscle all the way down to all these tendons, that's going to be your extensor digitorum longus. Don't confuse that with the extensor digitorum on the arm. So think of that as a long muscle, extensor digitorum longus. Follow that down to all those tendons. Extends digits 2 through 4. You've got the fibularis or peroneus longus. I'll take either or. That's this muscle right here. Right there. If you wanted to call it fibularis longus because it's by the fibula, that's fine, or peroneus longus, I'll take either or. What that's involved in is plantar flexion. It's involved in plantar flexion. As well as the gastrocnemius, what people call the calf muscles. There's your calcaneal tendon right there, or what people call the Achilles tendon. But this is the gastrocnemius. You don't have to know lateral, medial, just gastrocnemius would be fine. What the gastrocnemius does, it plantar flexes the foot. Underneath that, you have the soleus. And the soleus is a rather large muscle. So if I was to take away that tendon right there, you'd see a lot more of the soleus. That's involved in plantar flexion. All this is soleus. Then up here, you've got the plantaris. And again, this is a lot larger muscle, but if I was to pull the gastrocnemius away, you'd see how large the plantaris is. And that's involved in flexing the leg at the knee, and also plantar flexing the foot. But again, the advantage of visible bodies, you can actually pull the different muscles away and see how large they are. Some hints. I'm going to use the study guide. major superficial muscles of the body that I've put on canvas. I'm going off that list. And it'll be similar to your skeleton practical, but here you're gonna have to know the muscle and the major action produced. I think I may have mentioned in the lesson plan, you can either use the muscle key that I provided or look at the blue text in the book for the muscle action. Pick a correct action and that's it. Again, this will be multiple choice, similar to your bone practical. Hope that helps. If you have questions, please let me know. And good luck on your test.